For Zimbabweans moms-to-be, pregnancy can be an exciting time. Information from the Centers for Disease Control and Prevention shows expectant mothers anywhere are also more likely to face complications if they contract COVID-19. But in Zimbabwe, there is added problem of expectant mothers having access to necessary critical care as the rate of skilled attendance has decreased to 20%. Correspondent Faraya Wokotuya reports.
When COVID-19 broke out in Zimbabwe, health workers, like many other people, were fearful of the new disease. The uncertainty around the pandemic resulted in disruptions to service delivery.
I think initially when someone got infected, we would say close the facility, and then until maybe we get to the bottom of what has happened.
That cut off expectant mothers' access to critical care.
Initially, about 75% of Zimbabwean women used to deliver under skilled attendance. In other words, under a qualified service provider. Whether it's a midwife, whether it's a doctor, whether it's a nurse who is not a midwife, but is qualified care. But this went down from 75% skilled attendance. We were probably getting about 20% skilled attendance.
Which led to an increase in home deliveries.
There used to be hospitals providing cesarean sections for difficult births. But then with COVID now, getting transport to get to the hospital was a problem. So what happened? A number of women were struggling to give birth. And by the time they arrive in hospitals, they actually are fatal. They die.
A health sector strike made matters worse. Almost all of Harare's 42 municipal clinics ground to a halt in July. City of Harare says service has since resumed at 70% of them.
But some, like this one behind me, are still closed, meaning women who need to access maternal services here have to travel far to access them.
Despite this, the city attended to more pregnant women and more deliveries.
Really, our antenatal care numbers have gone up this year. Actually, figures, when we looked at our figures up to the end of September, we are up by 25% from what we anticipated, which is up 25% from last year's values. That's the same as well as institutional deliveries that are happening within our facilities.
While COVID-19 imperiled many lives, it's also led to innovation in reaching pregnant women in rural areas.
Because they couldn't get to the facilities, we look for the food distribution center, where the health providers of that district will be there that day to also assess nutrition and piggyback some of the maternal health services.
Taking maternity services to women and helping pregnant women access maternity waiting homes could save many lives until the pandemic is brought under control.